I only hear Terry talking to me. Good morning, everyone. Before we begin, I'm kindly asking you to just ensure that all cell phones are on silent. Please. We will be recording the first part of our activities this morning. So please, I'm kindly asking you to put all cell phones on silent. Of course, ladies and gentlemen, we have to start this morning's proceedings with the Lord because without Him, nothing would be possible, right?
Amen.
Amen. So we have to show some reverence for the Lord. So please lower your heads. I'm waiting on my friends around the back to just grab a seat. We have a few seats up front. Don't be afraid to come close to the front. So please, ladies and gentlemen, lower your heads in prayer. And you can pray along with me. We're going to say the Lord's Prayer to open the activities this morning. So let's go. The Lord's Prayer. Our Father, who art in heaven, hallowed be thy name. Thy kingdom come. Thy will be done in earth as it is in heaven. Give us this day our daily bread, and forgive us of our trespasses, as we forgive those who have trespassed against us. And lead us not into temptation, but deliver us from evil. For thine is the kingdom, the power, and the glory, forever and ever. Amen. The Honorable Juliet Cuthbert-Flynn, State Minister in the Ministry of Health and Wellness, Dr. Lovette Byfield, Principal Director of the National Family Planning Board, Mrs. Claudette Pious, Executive Director of the Children First Agency, Mr. Ajay Shackelford, a member of the Jamaica Youth Advocacy Network, Dr. Terry Reed, our moderator for this morning's panel discussion, members of the media, students who have joined us here this morning, specially invited guests, ladies and gentlemen, a very, very special and pleasant good morning to you all.
Morning.
Good morning.
Morning.
All right. Welcome to the National Family Planning Board's launch of the adolescent-focused social media page, Yute Expression. Are you all excited about this new page and platform? If you are, a round of applause for me, ladies and gentlemen. My name is Talia Suarez, and I'll be guiding you through the event this morning. It's an absolute pleasure to be here. And for those of you who are a bit unfamiliar or are unsure about what Yute Expression is specifically, it's a safe platform curated by the National Family Planning Board for you or youth. It's very, very safe, and it's for the youth to talk about sexual reproductive health, where they can receive information from a reputable source, right? Knowing the truth, getting the facts, and we're not talking about miscommunication or myths. We're getting rid of that, hence the tagline, know the truth, get the facts. All right? So that's what Yute Expression is all about. And when we talk about facts, we're talking about family planning. We're talking about abstinence. We're talking about condom use, right? Consistent condom use, to be exact. And of course, testing. All right? So this morning, we have lots of information for you. And this is only the beginning. I should tell you that, right? So I mentioned the event, and we'll have three parts. Of course, the launch of the social media page. Then we get into a very, very informative panel discussion, all right? And it's all about looking closely at sexual reproductive health and how it has actually impacted the lives of youths and adolescents. And then finally, we have our award ceremony for the Yute Expression competition. It was actually a three-part rebranding competition. We had three categories, to be exact: the mini movie, the jingle, and of course a development of a poster with all the key information which surrounds, sexual reproductive health and that kind of thing. So we have a very, very exciting program for you. But before we get into that, I have to make a special welcome and actually address our students in the audience. Hi students, how you doing? Yes, I see students from, is it St. Hugh's High School? Don't be afraid to, boy, you just put up your hands.
We're the swans.
But
We're
no,
the swans.
just put it, you don't want to make a little noise. So I see St. Hughes in the building. Woohoo, all right. I see Dunoon Park Technical High School as well. We have students from Jamaica College in the house. We have Waterford High School. We have Yallas High School as well. Penwood High School. Okay, yes.
Yallas representing, boy.
Yallas representing, loud and proud. Penwood High School. Yes, I'm loving it. And of course, Kingston Technical High School. So a round of applause, students. Thank you so much for joining us. And you were actually like specially handpicked to be here. So you really should feel extra special as a result of the partnership between the schools and of course the National Family Planning Board. So thank you so much for joining us here this morning. But before I hand over to Dr. Terry Carell-Reid, I have a giveaway. I will warm one up a little bit because I know, people like giveaways and nice things and free things. I know, so I just want to warm one up a little bit, right? Because it's all about you, the youth, this morning. So the first person to tell me what were the 3 categories for the Yute Expression Awareness Competition. Nobody on my panelists, like any of my panelists can't answer, okay?
That's not
Nobody,
fair.
Right? That's not fair. You have to come closer, man. Come on, don't be afraid to come close to me.
Come on.
What were the 3 categories for the Youth Expression Awareness Competition? The jingle, the mini movie, and the poster. Yeah. Round of applause for her, ladies and gentlemen.
What school is that?
Which school are you from, my darling? Which school? Kingston Technical, representing our first winner. So I will have lots of giveaways, right throughout the morning. So make sure you listen, you pay attention, because I'll be asking lots of questions and giving you lots of nice things, okay? All right? So I need to give, what is your name? Apple? Apple. What a unique name. I tell you about these millennials and them fancy names, Apple. When it's not Apple, it's Star. And when it's not Star, it's South. Or not. I'm just saying. Our name's not going on with anything again,
We're boring.
Nobody no name Terry.
Boring.
Nobody no name Talia. Nobody even name Ashley again. I don't know what's going on. Minister. Boy, what them would have said about Juliet? I don't know. I don't know. Apple, did you get your prize? All right,
Beautiful.
Good stuff. All right, now I will now hand over. She is my friend, of course, a colleague of mine. You are quite familiar with her from, Digital Rising Stars on social media, or Jamaican Girl, ladies and gentlemen. She'll be our moderator this morning for our panel discussion. Dr. Terry Carell-Reid.
Thank you. Thank you so very much. I think you guys could do a much better job for Talia. I think she did.
Yeah, of course.
With the energy, she brought the energy. I'm going to sit forward a little bit just so that the audience on this side can have an opportunity to see everything that is happening. Before we begin, Waterford High School? Are you guys here?
Nice.
You guys were so quiet. You have a poor mama come from me now and so quiet. Waterford, if you did that, I thought you'd been alone. Where is that? Sunshine City. I'm just saying. Thank you so very much. Now, it is an honor to be here and to serve as a moderator. And certainly when we start to look at the topics of youth and how layered it is, we could be here all day. And then when we select and we decide we're going to pick out and speak about sexual reproductive health, then we know that we could be here all year. Now, I have been tasked to moderate this panel discussion that should be about 45 minutes, and we have some key stakeholders, people whose words, thoughts, and actions play an impact on the topic of sexual reproductive health. I'd like to introduce my panelists, the Honorable Juliet Cuthbert-Flynn, State Minister in the Ministry of Health and Wellness. Thank you so very much for being here, operating in the space of a policymaker. Dr. Lovette Byfield, Principal Director, National Family Planning Board. Thank you very much for being here. Mrs. Claudette Pious, Executive Director of Children First Agency, and Mr. Oje Shackelford, that's a real rich name, a member of the Jamaica Youth Advocacy Network. Thank you so very much for being here. I'm going to start out with just a few stats because we don't just want to have the conversation but not have it be put into context. The mean age of first sexual intercourse for persons between the ages of 15 and 24, the range for boys is 11 to 13. The average boy between the age of 11 to 13 is already having his first sexual intercourse. For females, it's 15 to 17. 48% of youth between the ages of 13 to 15 years are reported as being sexually active. We're looking at children who are barely moving into, they still call it CXCs? Or C-Sec, what do they call it? Because I was a common entrance baby, so we called it CXCs when you get to fifth form. So before they're even getting, fifth form, sixth form, they're already sexually active. 40% of Jamaican women have been pregnant at least once before the age of 20 years. And more than 80% of adolescent pregnancies, that is between the ages of 15 to 19, are simply unplanned. They didn't even know it was going to happen. 18% of all births were to teenage mothers. 15% of births occurred before age 18. And the national proportion of births to teens in 2014 was 17%. And I think it is important for us to understand what these numbers represent. So now I'm moving over into the panel discussion. And Minister, I start with you. Simply, while we were preparing for this particular planning, for this particular panel discussion, we were looking at sexual reproductive health and reproductive rights. For those of us who are here, what does it even mean to have sexual reproductive rights? What are we even talking about? From a policy standpoint.
Right. Thank you so much for having me. This is really an important conversation to have, and I'm really happy that students are actually listening to what we're going to talk about today. But microphone, but the that just mentioned.
Hold on 1 second, Minister. I'm going to give you the opportunity to get a handheld simply because we don't want to miss anything that is being said. So again, the question, as the Minister settles, again, the question is, a lot of the times we speak about sexual reproductive rights and the youth have rights, but what does that really mean?
Right, and I actually prefer this microphone because I was having issues with the thing at the back. I think it's really an important conversation to have. Just with you mentioning the statistics that you just mentioned about the early age that teenagers are actually having intercourse. When you talk about reproductive rights, however, that is something that is near and dear to me. Because I think we should all have the right to our bodies and what decisions we make. However, it gets a little, in a little zone there when you talk about the age limit, when you talk about accessing contraceptive, and that is why we definitely need to have a clear policy guideline in the Ministry of Health and Wellness to guide us properly. Because whether we want to believe it or not, I think Jamaicans need to hear the statistic that you just mentioned, that teenagers are engaging in sexual activity. And we must protect them in whatever way that we can, and to afford them contraceptive if needed. And of course, also, when you get into that lower age group, to possibly do some interrogation to find out exactly, is it abuse? What is it? What is the reason?
Coerced?
And so I think it's very timely that we're having this conversation about sexual reproductive health and rights of our children.
I do as well. Thank you so very much. And thank you for your advocacy. Again, when we're looking at the rights, we're talking about you not just having to make the decision in terms of what you are doing, but also having access to information and access to health care as it relates to your bodies. So it's a 360 approach. I'd like to acknowledge the presence of Ms. Talsia Hamilton, Health and Family Life Education, HFLE, which is what is now being taught in schools. I'm an officer, Ministry of Education. Welcome. Thank you so very much for being here. Just making sure your mic is on. She said good morning 3 times. Have we heard her? All right.
Power light, but
All
okay,
right, there
I
we
can
go.
hear myself now. Good morning. Thank you for
Fantastic.
having me.
Fantastic. I'll soon get to you with the question. So, Dr. Lovette Byfield, based on where you sit, based on the bird's eye view, and based on some of the statistics that I just read earlier, I just shared, could you provide more information on the work being done to not only support but address the sexual reproductive health needs of Jamaica's youth?
Thank you so much for asking that question. And more than anything else, I want to thank the students for coming out, because this information is basically for you. And as much as we might use different channels, I'm not sure that you're aware of it. We at the National Family Planning Board, we are taking on a comprehensive approach to sexual and reproductive health. And we recognize that based on the statistics, those who are most vulnerable are our adolescents. And so what specifically have we been doing for the adolescents? We have a collaborative approach between several of our partners. And so we have worked with the Women's Center of Jamaica for those who might have had a pregnancy. We also have worked with our partners who do outreach. And right there at the Family Planning Board, we are also looking at how we can improve services. Through our collaboration with the Ministry of Health, our central office, we have been working with the Teen Hub, which provides services to our adolescents. I don't know if anyone here, we have a number of Kingston schools here, but the Teen Hub is at the Halfway Tree bus terminal, and that is where we provide a safe space for our adolescents to access services. Some of you might have already accessed services there. Regardless of your sex, i.e., male or female, it's open to you, and you can get all the information as it relates to sexual and reproductive health. We have also been leading in terms of how we can work along with the minister and the policy department within the Ministry of Health to develop the sexual and reproductive health policy, which is very critical because that is looking at how services are provided for everyone and ensure that the rights that you mentioned, that those are being observed and persons feel free to access. There's also been some special training because some of the things we get back from our partners and also from our population is that when they go to access services, they don't feel very comfortable. So we, in turn, have been training our service providers. We have been training our nurses, and we have been seeking to see how we can build their skills to have conversations around sexual and reproductive health with the adolescents who come into whether the public facilities, and we also collaborate with our CSO partners or NGOs, those who offer services, so that they can feel more comfortable. They'll not feel as if they are indeed being berated or in any way being made to feel uncomfortable, so that they can speak about their issues. Within the ministry, within the Family Planning Board also, we have the counseling service. Our mandate is for both contraceptives, but also we have a very crucial mandate as it relates sexually transmitted infections, with our primary responsibility being prevention of STIs and HIV in particular.
And Doctor, I don't mean to interrupt you, but I think what you just brought up was a very interesting and very important part, because a lot of the times when we speak to youngsters and we speak to them about sex, a lot of them put a lot of focus on pregnancy. Not necessarily getting pregnant, using contraceptives just to ensure that maybe they don't get pregnant. But the conversation in terms of sexually transmitted diseases is kind of just like a secondary, tertiary, and afterthought. So I'm very happy that you mentioned that.
And just to reinforce that, I think because it's more visible, you're being pregnant and what are the possible consequences, then we find that the preoccupation is with finishing school and not getting pregnant. But the important thing also is that if you're engaging in sex, you're at risk of HIV and at risk of other STIs. And so for us, the important message is how do you protect yourself? But we also have very important messages around abstaining. So for us in the schools, based on our collaboration with the Ministry of Education, in the school, our main focus is on a program we call Hold On, Hold Off. And I think some of the persons here would have benefited from that program. Hold on, wait.
You're not missing anything. Just cool, just cool.
Yeah, we're going to teach you how to manage the urges that you're having, because it's natural. right? So we're teaching you how to hold on, how to wait, how to just rest a little bit and just manage it a little differently. In addition to that, though, or in addition to that, we also have done some media campaigns. And right now, there's a campaign on air. I don't know if anyone here has heard it. The message is, live life before you give life. Anybody here has heard that message?
Show of hands? Show of hands?
Yes, live life before you give life. Because we're basically saying there are a number of things that you want to achieve before you get pregnant. And so how do we prepare the ground for you to do these things prior to you're making the decision? And this is where we move into the family planning part now. You're planning your family, and we're ensuring that there's access to contraceptives for you. After the age where you are at a stage, if you're sexually active, we're going to ensure that you have access to the particular methods. And we're promoting what we call long-acting reversible contraceptives.
Say that one more time. Say that one more time.
Long-acting, it takes long. You have it for a long time. And it's long-active. Reversible, pardon me. Reversible. That means you can take it out.
Yes.
You can take it out. And that's the method. So these are some of the things like the 3 months injection, and we have the Jadel, and we also have the IUCD that we do. But these are primarily for our persons who are in that age group where we recognize that the taking pill thing, not really going to work. You see, don't tell us about condom use, you're not going to practice no condom use. Especially when you're in a situation where we have some young people, unfortunately, where it's forced or where they are not in a position to negotiate because they're involved with persons who are at a different place, have the economic handle, you know, they're managing. So we're saying, if you're in that situation and you're over 16, you're over 18, that is the method that we are promoting for you. You take it, you relax, you come back 3 months. You take it, you relax, you come back 3 years or 5 years. Okay? And those are the methods that we're promoting for persons within this age
And
group.
is this information also found at the Teen Hub?
At the Teen Hub, on our counseling service, which we are now rebranded, because I don't know who would have known about Marge Roper sitting in this room, not even me, and I'm a little bit gracefully aging. Right. So we are totally rebranding it and calling it Yute Expression.
Lovely.
You need your information, this is a safe place to get it. And you can have all the conversation you want around sexual and reproductive health.
Thank you. I think what I enjoyed about Youth Expression is a lot of the times we have conversations about youth and for youth and on behalf of youth, but then you guys are not necessarily a part of the conversation. And I think it was very important for Youth Expression to be created to give you a voice as it relates to your sexual reproductive rights. I'm going to come across to Ms. Hamilton simply because you represent HFLE, which I said earlier. I'm a common entrance baby. You guys are GSAT? PEP? Put up your hands. Who was GSAT? GSAT babies? All right. Any PEP? Not really. Okay, no PEP. Okay, so GSAT. So back in the day when I went to school, I think we had a guidance counselor, but at school, there was no form of sex education. You might have learned that maybe you were going to see a period, maybe you didn't. But I've spoken to different generations, and we can all agree that we were just not suitably informed. We were all kind of taught, work hard, get the grade, get the job, get the partner, get the house, and everything is gonna be okay. Family, hooray, hooray. So I've heard about HFLE, and I understand that this is comprehensive. So what I want to ask from you now is, in terms of the Ministry of Education, in terms of the relevance, what our youngsters are exposed to, social media and those that they are exposed to in some of their communities, how is HFLE positioning to be the hub or a resource of good, suitable, relevant information?
So, being a common entrance baby myself, I can definitely identify with what you are saying. So, back when we were in that place when we needed HFLE, we had the genesis of FLE, Family Life Education, which basically blossomed into health and family life education as the years went by. So it is really that tool that exists to provide psychosocial support for our students from the very beginning. We have a curriculum that spans from the infant to grade 9, and we do have schools that go all the way up to grade 13. Now, health and family life education is literally what the name says, and it is delivered under 5 themes. So in math, we manipulate numbers. In language, we manipulate words. In health and family life education, we manipulate life skills and values. And they basically sit within a framework that helps students to practice, to troubleshoot real-world issues and apply the steps of those life skills and the concepts of those values to their own lives. So just as you would expect a music student to back your devotion at school, your HFLE students will drive behavior change. Whether it is you want them to do something differently, start doing something, stop doing something, it is all about practicing that behavior change that we want to see. Now, HFLE is not a subject that is content driven. It is mainly driven by life skills and values. Hence, we will find ourselves borrowing from virtually every subject area you can think of. So the themes are self and interpersonal relationships. That basically helps you to understand more about yourself, intrapersonal relationships, interpersonal relationships, and basically navigate issues that are related to that. So under that theme, you will see youngsters exploring about who they are, how do others influence me, what can I do, to improve on this or to improve on that, what will I do differently the next time around. And you also look at your place in society. Where do you fit within your family, your community, all the different spaces within you which you exist. Then we move on to appropriate eating and fitness, which is very, very key. And especially in this day and age where we see we're younger and younger, we're finding people presenting with non-communicable diseases. That is very, very fitting. And of course, we know when we were in high school, it was food and nutrition. So you will see where now family and consumer management, much of the knowledge that is gained from there, along with information that is passed on through HFLE, we see where the students are able to apply life skills like healthy self-management, values like self-control, in order to make better choices when it comes on to literally taking care of their fitness, their nutrition, their general health and well-being.
And I think it's extremely important for a lot of them to start to develop the who am I?
Yes.
And because a lot of the times the decisions that we make, the compound effect of the decisions usually stems from how great we are at saying, this is who I am, this is what I stand for, I'm not going to take this, I'm not going to be influenced by that. The question is, with HFLE, how does it now tie to the sexual reproductive health?
So that's where we're coming to next. We have 3 other themes. One of them is sexuality and sexual health. That takes you from understanding how your body works, the physical changes, physiological, psychological, HIV, prevention, other STIs, general knowledge, how we are affected physically, emotionally, and so on. And one of the key things we find is that this is probably one of the areas where we have the most aha moments. I'm surprised I didn't really realize that this happens to my body. Didn't really realize that this that I'm experiencing is natural and that I'm expected to go through it. Or I didn't really realize that if I sit and I take the time, or if I'm able to work through these issues, then I can actually cope. And I am not the only one who is going through this. So it's very, very important to have this tool, because just as how we have vehicles, we all know that if we have a flat tire, it needs to change in order for it to work. Hence, it's very important for our young people to learn about their bodies, because we are sexual beings. And it's very important to know about your reproductive health, especially during a time where sometimes we wonder if there is anything beyond thinking about me, beyond my body, beyond who I am, you know, in terms of how I may present physically. So it's very, very important.
Thank you. I have another question, but that will be my follow-up question after I go through everyone. I'm coming across to you, Claudette, in terms of I want to know about the programs. You know, Children First, I've heard about it. The question is, you know, what is the program and how does it support our youth, especially when we understand that they're in the room. A lot of the times, even though we're going to have the school and the psychosocial and we have the communities and we have the teen hub but we know that we can't always be there when they have to make certain decisions. So talk to me about Children First.
Okay, thanks very much. I really feel honored being possibly the oldest one in the room. But I think I've earned the honor based on the fact that for 25 years, Children First have been doing this work.
Yes. Round of applause, absolutely.
Thank you. And from where we sit, young people have a say in what we do, and that's very important. So they, in fact, inform our programming. Nothing for us without us. So we are very much into the discussion, using the language that the young people understand, and really helping them to understand, navigate and understand their various situations. So Children First really looks at holistic development in a real way. So we have skill training programs because, you know, the young people I work with mainly are from very poor situations. And we need to empower them so they can understand that value and worth.
Yes.
Yeah?
Amen.
So we spend a lot of time in the life skills, but as we go on, we do practical skills that they have an earning power. Because without that, you find that a lot of our young people
Vulnerable.
go into forced sex and also go into massage parlors and prostitution. And that's real. We work with female sex workers. We work with male sex workers. We do a lot of work, really, in helping our young people now to move from hopelessness to where they're taking charge of their life. And their sexual health is very much an important part of this discussion.
And can anyone call? Can they just call? Can they pick up the phone? Can
Yes,
they
they
register?
can call, yeah, and we are very blessed. Thanks for the partnership with the Ministry of Health and our international partners, Global Fund and USAID. We have psychologists, bless God.
Amen.
So we have only one psychologist, but believe me, we have social workers, we have peer navigators, and we do a lot of work at the community grassroots level. Or it's the home of the Bashi bus. Sorry. And most people here would know about the pretty bus that goes into communities. And what we do, we go in the communities, we start conversations, we perform. So meanwhile the drama is going on, you can talk to a counselor, you can get tested, we drive out the community with your business, so nobody in the community know.
Can take it, tell you.
Because one of the challenges, we did some research, and one of the challenges we found is that they were not trusting the public health system because everybody know everybody in the community.
Of course.
So we do a lot around helping persons to own themselves and their lives. We also do a lot around helping them to get jobs. And we work in schools in partnership with the guidance counselors. A guidance counselor will call us and they'll tell us what's happening in their school. We go, we spend time with them, and then we create a targeted intervention. So we don't just go and every one size fit all because it wouldn't fit me. So we go with a targeted intervention. We do it for your school. We follow up. Sorry. Because we find that young people want to be able to communicate. And they want to communicate with their peers. Yeah? I am very blessed that when I go in a school, they want to talk to me. But and I think it's the connection, and young people feel you. And if you just, I mean, a challenge I have is that in a lot of cases, the trust is a big issue. And young people are not talking to you unless they trust you, especially around their sexual health. And I think we need to really take it from that place. And I'm very happy that this is happening because young people want a safe space that they can discuss their issues.
Absolutely, without being judged. Thank you so very much, and thank you for the work that Children's First absolutely does. Oje, you are the youngest, probably, on the panel, maybe, just putting it out there. And you represent the youth body, right? You represent an entity, Jamaica Youth Advocacy Network, which means that you are right there in the middle. While the panelists were speaking, you are nodding in agreement with a lot of what each panelist said, probably because of the network and the fact that each of us has to help the other. What are we getting, based on what you have seen, based on the youth you speak with, that you work with, what are we getting right and what are we getting wrong, in your opinion, based on what you've seen and experienced?
Thank you so much for that question. One thing I can definitely say that the ministry and other bodies are getting right is targeting young people through social media. We know we're always on our phones. I came up here this morning, I was on my phone typing away. So targeting young people like myself on social media is something that you're definitely getting right. And I really appreciated the fact that Children First is really going into communities, because as much as being online and being on social media is beneficial, we need to also take into consideration the fact that a lot of rural youth and inner city youth that might not have access to those things. So actually going in and speaking with them on a greater level can be very beneficial. But I think that for the most part, especially with the consideration that this conversation is happening, that we're doing a good enough job. And there's one thing I want to touch on. When you were mentioning the statistics,
Yes.
something that really, really stood out to me is the fact that most males, I don't remember the percentage, between the ages of 11 to 13,
First sexual encounter. Madness.
I think that we live in a society where males are hypersexualized.
Culture.
And we live in a culture of hypersexualization, where males are forced or they're coerced to have sex at a younger age. And having sex is some achievement. You get ratings from your friends and probably even your family when you have sex. So I think that in that consideration, we also need to target those persons that are more affected, that may be rural youth, that may be inner city youth. And another thing that we also need to pay a lot of attention to is the fact that our parents and guardians play a major role.
Man, that's one of my questions. That's one of my questions. Go ahead. No, go ahead.
I'll be brief. So Yute Expression is targeting young people. But we also need to remember that most of our socialization as young people comes from the home.
Yes.
So having conversations with parents and guardians and older persons to actually have conversations with their children can go a long way as well. Because we find that ignorance is where curiosity is born. So if you have someone to actually speak to you about certain matters, you don't need to explore and know everything. You have the knowledge and you have the guidance.
Thank you so very much. Oje, you totally stole my question. That was going to be my question for Dr. Byfield. But I come across to the minister. So it's a great segue because I just asked Oje based on, you know, he's on the ground, he's hearing, he's moving along amongst his colleagues. He understands what they're saying and what's working and what's not. From a policy standpoint and hearing the statistics, what do you think are some of the key areas when speaking about sexual reproductive health that we need to address on a very high level?
Yes, definitely. I mean, it's almost frightening just listening to, and I was reading some statistics last night myself and encountered what you mentioned about the early age of our children having sex. And this is why I believe when we look at the concept paper in the Ministry of Health and Wellness, we must act. We must act as legislators to really take, and as a government, to take a look at what is not there to protect our children, to protect our adolescents when it comes to sexual practices. And what we don't have at this time is a policy, right? We don't have a policy. That is being worked on. We're working on that very hard.
Yes,
Ms. Byfield can tell you that, to make sure that that becomes a reality by at least this year, if not into early next year. We know that it should be going to cabinet shortly, and it is very comprehensive. When you look at some of the work, however, with NFPB, National Family Planning Board, they've been doing a lot of work when it comes to educating the population, and that is important. So even before the policy takes effect, you know, we have a 72% of the population, especially the adolescent, actually accessing birth control, accessing contraceptive that you heard Ms. Byfield spoke about. We have the antenatal clinic for high-risk pregnancy because, again, as you mentioned, our youths, we have a high rate of our you know, young people, teenage pregnancy before the age of 20, as you mentioned. And so the clinic is already set up for that in all parishes, by the way. So there is a high risk. And as you know, if you get pregnant at an earlier age, you have the possibility to develop complication. And so the high-risk pregnancy clinic is there in all 14 parishes. At the Kingston Jubilee Hospital, you also have the teen clinic. So that is...
don't mean to interrupt, do they have to be accompanied if they are minors by adults? Because this is where it gets very tricky for me, right? A lot of the times minors are not able to necessarily source information and get access to safe spaces because a lot of the times they have to be accompanied by an adult, and sometimes that adult in the family is actually an abuser or knows of an abusive situation. So I want to know, how can they just walk into the clinic and get access without?
Well, we're talking about pregnancy, so yes, they can access. And this is where the policy comes in with the 16 years. 16 years is the age of consent.
Correct.
And 18 is where you don't need parental consent. And so now what we must do as policymaker is to merge that somehow to get it right. And that is being worked on as we speak, because it is very important to get that, if nothing else in the policy, is to get that right. So we can look forward to something happening coming forward in the next few months. You should possibly hear about that, and that it will be policy so that children can access you know, whatever it is, birth control or access clinic. But as far as now, no, they don't need to actually, it is happening. This is why you talk about safe space. The Teen Hub is a safe space for these youngsters. Ms. Byfield mentioned the one in Halfway Tree, and I'm very happy to say we heard that there's some students here from Yalas. Guess what? There is one coming in Morant Bay. By this summer, by June, by the end of June, there should be another teen hub in Yalas where this is also seen as a safe space for the youths where they can get counseling, they can access contraceptive, and also to put a little, and we have to thank the EU for that, the partnership there with the Ministry of Health and Wellness in order to get this going so that our youths can actually have a space, safe space. And it's not just the counselors, you know. When you speak to them, when we had the groundbreaking ceremony in St. Thomas, you heard a lot of the teens said it was good for them to actually have other teens to actually sit and talk to, and then you have the counselor to give them the advice. So policy-wise, we must get it right so that we can protect or youngsters.
Absolutely.
And that is being worked on as we speak.
Absolutely. I hope the Teen Hub it's just totally island-wide, every single parish, I hope that is probably what my ultimate vision is.
Yes.
Going based on what Oje said, Dr. Byfield, and this is a real issue. So we have these messages, we have the training, we have the hub, we have the information, we're targeting the young, but Oje made a very important point, and that is a lot of them exist in spaces, in communities, where there are subcultures. And of course, we have our socialization and we have our culture that becomes a part of our DNA. So then it stands to reason that we now have to also have the conversation with the parents and the communities. But it also means that we have to be having a higher level conversation where this is not okay, meaning this is not something that we even want to accept as a part of our culture. So how do we get them the right information, but also insist that the family members are also a part of that value chain?
That's a very good question, because we have been battling with this challenge over the years. And one of the things that we do on the ground is that a part of the hold on, hold off, which is usually done in the targeted communities, i.e. the communities that have high prevalence, and where we have been called in by the MOE, the Ministry of Education, based on the prevalence within a particular school to do that. We have a parent component. So we do a full community intervention around that particular location in an effort to reach the parents. We also have, it's a full school approach, so we go through the Parent Teachers Association, but those would be the parents who come to PTA. Apart from that, though, we walk in the community and do the outreach at what we call chill spots, for the adolescents who might not come into the particular, they might not be at the school or into another location, but we also do community parenting workshops, where we encourage the parents to come, let us sit and talk. Let us have some conversations around the issues. And the issues are many, because there are also issues around sexuality, for they themselves don't understand, and the sexual orientation issues around how do I deal with my young male who I think might be an MSM, those issues that they have challenges around. We try to help them to have that kind of discussion. We also have worked with the Parenting Commission, and at different times we have gone into support the other NGOs who are working in parenting to see how we can build their capacity to have those kind of conversations. Because that a lot of the parents and the parenting comes from thou shalt not, rather than how do we do this better. So that's where we find that the conversations have to start. We recognize that there might be particular pockets that we have identified in terms of what we see happening in terms of incest, in terms of some other behaviors. We look at how we target those communities as well. And that is primarily through the regional health authorities, not necessarily NFPB, but we have outreach workers who are working in those locations, and they would be the ones who would be developing the longer term interventions. But this is not just a one-off. It's how you work repeatedly within the communities so that you can build the trust, get the other persons on board, and have the conversations, and promote where they can get further information, because that is also important. And important for us, all of that is toll-free or on the WhatsApp line, so it's not likely to be a big cost for them, although I know we have challenge with services in some instances.
Right, thank you.
If you'll allow me, I think it's also important to mention the work of the Spotlight Project.
Talk to me about the Spotlight Project.
So the Spotlight Project, really, the work that we have been doing is really around prevention of gender-based violence. But we spend a lot of time also looking at sex and sexuality and reproductive health, and including the adolescents very much, and the parents. So we do a lot of work with parents, and we do a lot of work with men, because we find that in a lot of these interventions, the men are not included. Yes, so we go to the football field, we go to the bar, we go to the corner, and it's really that interaction that also helps us to inform how and what's happening in the community and how to work with the adolescents.
Thank you for that. Thank you for that. Because, and again, there's just so many things, so many agencies doing so many great things, but we don't always know that we can all be advocates to also share that information. I know my time is running out. I know Nikisha soon give me the time, but I'm coming across to you. So I'm the mother of a 10-year-old. And persons who are a part of my social media platform knows that at the age of, by the time she was 3, I had already started talking to her about period, menstruation, feminine products, any question she has, I answer. Once she asks, Mommy, what is so-and-so? It didn't matter to me what age. Now, I know that I fall in the minority, and I know that a lot of parents will not agree with my parenting style, but that's their business.
That's fine.
I'm telling you what I do with my daughter. and so I realized that in my day, a lot of us grew up being self-conscious and uncomfortable with our own bodies. And we didn't even know the decisions that we could make with our own bodies because we were not taught about autonomy and ownership. I am very big on that. So you have the church that in a lot of cases is saying, thou shalt not. Abstain, abstain, abstain. You have some parents who understand the importance of these conversations, but they themselves feel uncomfortable because that is where they're coming from. They're uncomfortable because their parents were uncomfortable. And then you have parents saying, I don't want the schools teaching my children sex education. Them not teach them children sex education, but you will not teach sex. So how, and I mean, again, this is a dance and this is a conversation. How do we balance, even with HFLE, how do we balance it that, I guess, all stakeholders are benefiting, but that it's actually impacting the persons it's supposed to impact? Because we do them no service when we talk about all the different life skills, and that's great. But the moment they step out into this world, they don't know what to do. So how do you guys balance sex education and really getting into, maybe not all the nitty-gritty, but giving them enough information that is packaged that everyone will say, this is necessary?
Giving age and stage appropriate information is key. And it's also key to help parents to understand what's in the curriculum, how it is being delivered, and to also remind parents that the information that you refuse to give to your child, someone else will offer the information, and it's a gateway for misinformation. It's also a gateway for sexual grooming, a gateway of increased likelihood that the child, unfortunately, may end up being taken advantage of from so many vantage points that we cannot even begin to fathom. It increases the likelihood of being trafficked, so much more. Therefore, it's very, very important for teachers, parents, and other stakeholders to partner to ensure that we give age and stage appropriate information. A quick example. For kindergarten, you'd be teaching the correct names of the body parts.
Yes, ma'am.
And you would be teaching what a good touch and a bad touch is. You'd be teaching who is a trusted adult, and you would define that properly, and you help them to recognize the signs of this person is not doing something that's good, and I need to report it. We have the children practicing skills like refusal skill, no-go tell, right? We have them, understanding what are some telephone numbers that we can dial. We have them using techniques like the empty chair technique to practice having that conversation when I'm afraid, to, using values like bravery. So something that usually gets a parent is when we keep a secret from our child in terms of that information, somebody else will have them keeping a secret from you. That usually hits a chord, and none of us want our children in that position where they are more vulnerable than everyone else. And those are the ones that are usually targeted.
Well said. Thank you so very much. And that thing about trusted adults, even then, so for example, I've taught my daughter who we consider to be trusted, but I've also told her that the moment that person breaches or violates,
Yes.
that is no longer a trusted person.
Yes, and help not just the trusted adult too, in terms of recognizing the red flag. I could be a doctor, a teacher, a lawyer, whoever it is. It doesn't preclude me
Correct.
from possibly taking that decision to do something that will hurt you. So that's also important.
Thank you for that. And I've told my daughter that I'll believe her. I told her 2 things. Tell me the truth, you'll never get in trouble. That's your get out of jail free pass. Tell me the truth, you'll never get in trouble. And I do that simply because if we establish trust, and she knows she won't get in trouble once she tells me the truth, we're good.
Yeah.
And then, and secondly, it is whatever it is, no matter how uncomfortable it is, I will stand and I will support you. I think a lot of students, a lot of children experience different kinds of violation, and the very people who they hope would stand for them, they don't. And so they're left. And so it's very important for them to know the agencies and the entities that exist. I know I have to wrap, but Oje, I'm coming across to you. There was the mention of misinformation by Ms. Hamilton. So important. As you rightfully mentioned, even though we do have some youngsters who may not have access, and the credit and the data and all of this, but we do know that there is things that go viral on social media, and once things go viral, everybody knows about it. I mean, it doesn't even matter if you're in the same age group, niche, category, gender. Once something goes viral, everyone knows. And what we've realized is that misinformation seems to travel so much faster than the credible sources. So since you have an opportunity to speak to youngsters, what can they use to identify the right sources, the credible sources, and what do you encourage or discourage them from doing when it comes to sharing information that could possibly be misinformation?
Thank you so much for that question. I do think that it's a very important thing to consider, not just in getting information with regards to sexual and reproductive health, but right across the board. I'll start with the first thing, which was what?
How do they identify, possibly?
Right, how do they identify? One thing that I always look for when I'm reading information is statistics, right? When you see the presence of statistics, it usually leads to something else. For example, with COVID-19, a lot has been going around about COVID-19 that's not true. Somebody said on Facebook, for example, that it caused them to be infertile. Untrue, right? When you see statistics, whoever's disseminating that usually points it to something else. For example, 30% of young people are going through this. It is said by NFPB and that sort of thing. So there are different indicators that you can look for. And one thing that I would encourage and discourage you to do with regards to getting information is if you see something and if you're not sure about it, do your research. The fact is, information is online. Information is printed. It's always here, and especially with the launch of Yute Expression, thankfully, we'll have an easier way to go through that information. But do your research, please. We find that, as you said, a lot of information is passed on WhatsApp, Instagram, Twitter, a lot of spaces, and misinformation and malinformation does travel faster than fact. And we know the whole trend of when something is going viral, you always get some WhatsApp message from some auntie. When you get that information, I'm begging you not to share until you know that it is credible.
Exactly.
And that is where research is important. Yes, the government and different entities have a responsibility to give you information, but you also have a personal responsibility to ensure that the information that you're reading and disseminating is factual and credible. So it goes both ways. One final thing before I finish. There is a trend with young people especially that we don't think that something should be shared unless it is trending with some, for example, like some famous artist and that sort of thing. Because we have to identify that, celebrities and dancehall is a very major thing in our culture. And I'm speaking to this with respect to young people especially, because the truth is that some of our young people They only hear what these dancehall artists tell us. And unfortunately, as I said before, some of them, they promote hypersexualization and the fact that if you're not doing this, you're not a general. Exactly. So you need to step away from that mentality that your celebrities are Jesus. They are not. What you hear in songs is not always the best for you, right? That's why it's so important for you to have an ear and have discernment so that when you hear certain things, you're able to pinpoint and do your research to ensure that you are getting and sharing the right information.
And just to add to that, you should be unapologetic about it. So you don't have to be a part of trends. You don't have to do the dances or the challenges or everything that you see on social media. It is okay for you to say, no, that's not for me. And to be completely okay with it. And if you have persons who maybe you describe as friends trying to suggest otherwise and trying to force you, then you need to really reconsider if that person truly is your friend. But you have to be unapologetic about the things that you will accept and the things that you simply will not. The last question, I'm going to ask a general question in terms of just a recommendation from each person, but this one is for the minister because I know that she's an advocate and I'm one as well, and I am actually very pro-choice. When we speak about sexual reproductive health and rights, and we speak about incest and coerced sex, and we think about the trafficking, we've heard about human trafficking from forced labor to forced sex, forced in gangs, and we look at the different layers. As a woman, and having been, as a female, and we spoke about it, it is more obvious when we are victims of sexual abuse. A lot of the times we are the ones who bear the physical burden, not just the psychological, but we have the social and we have the physical. We get pregnant and then we have to deal with persons judging us, thinking that it was our decision or our choice. Where does the conversation, even from an HFLE standpoint, which probably doesn't exist in the curriculum, I don't know, I'm assuming, where does the whole topic of abortion fall? And the reason why I'm talking about this is because for those of us who are using social media, maybe you would have seen the news that is taking place right in our backyard in the United States of America, where the Supreme Court, it was leaked, documents were leaked that the Supreme Court basically said, well, we might overturn Roe v. Wade, which was something that was there to protect and to offer citizens access to this particular health care if they needed it. We know if that happens, the impact it could have globally on countries that were trying to establish certain things. How do we have these conversations as parents, as teachers, as educators, as advocates, as activists? How do we have this conversation without it being one side versus another, but what is necessary for the person at the heart of the conversation?
I think it's always going to be, thanks for that question, it's very important to me. I think it's always going to be that one side having their opinion, the other side having their opinion, and it's always good and healthy. But I think we must also look at what is right for that person, that woman, that person that's making that decision. And I spoke earlier about the sexual and reproductive health policy. That is also a part of termination of pregnancy is a part of that policy. And I believe there's some other, the Buggery law is also a part of the policy. Anti-discrimination, stigma and discrimination is also in that whole thing to address those issues. And maybe that's why it's taking a little while. Because
it's
again,
heavy.
as you can understand, it's very heavy, it's very emotive. Persons draw lines when it comes to certain topics. But as you mentioned, not just mentioning here today, but just, I don't know how many people saw the paper yesterday. I read in the Observer where you have the 13 and 14-year-olds who are raped. And being impregnated, of course, and having the thought, do they really want to carry this child or because they were raped. We also know that there's also a high prevalence of incest in our culture. So again, all of this has to be re-socialization. We talk about that from everybody. Re-socialization, our society, the culture that we live in, the highly sexual culture that we live in. But so we have to look at that as policy makers, as what is happening in Jamaica, what is happening in our culture. When we look at other Caribbean nations, some of them have passed laws to actually circumvent some of these things, to say, let's look at the situation in our culture. Let's look at rape. Let's look at incest. Let's look at a mother's life that might be in danger. And I think we are ready. I think we should look at those instances in Jamaica when we're making our policy. That is something that we're speaking about now also. I'm also pushing that as the state minister in charge of maternal health. And so that is... We know that we have a new with Minister Marlene Malahoo Fort. I've been speaking to her about the topic. When you talk about the dissonance of between the age of consent, the 16 and the 18, that is also a part of all of this that we're speaking about. To say, at 18, but when you talk about accessing health care, that's the big thing. Accessing health care for my reproductive right. And so I think it's important for us to address it as legislators, as a government, to really look at the situation that we're faced with a high prevalence, as I said, of incest and rape. And if it is that, would I want to carry a rapist child? And who are you to really tell me that I should do so as the government, that I must do that? And so we have to, however, protect our doctors.
Yes.
Because if there is not a law or in place, or if there's not a policy in place for the termination of pregnancy, as it is in the policy at this time, then doctors are also they're going to refuse.
At risk.
And so we must make it a priority this year to make sure that this policy is in place to protect our most vulnerable.
Thank you for that. And I'm going to take that as a jump into my final question, which was, what is your final recommendation for the way forward? I think that just really summed it up for the minister. Dr. Byfield, you have a minute to tell us, what is your final recommendation for our way going forward? Our youngsters, sexual, reproductive health, rights, what say you?
Okay, so I wanted to just quickly say perhaps three things within the minute. One is as it relates to the males and how they have been socialized, because we have where, as it relates to HIV and STI, they present very late because of the poor health-seeking behavior. Man no go to clinic, man not the man. Take 2 red and black and deal with that. And you guys have heard that from your peers. I'd like to encourage you as young men, step out, be bold, be different. If something itches, smiles, or scratch, something is not going right.
Say it again. If something
itches, smells, or scratches, is the itching, the scratching, and if your seat has a different color, something is wrong.
I say drippy pippy when I speak to
right,
youngsters.
yes.
Drippy pippy is not cute.
It's not cute. Don't let your friend give you 2 red and black. It is not going to work. Oh, perhaps I don't know red and black. That's his capsule. That they tend to have the antibiotics. That is a very common street name for it. Please seek help. Go and get treatment. The other thing is, as you progress and become more adults, the woman and yourself need to have the conversation around pregnancy, around when is it that we are deciding to have a child, and prior to that, the young girl that you are engaging with as a friend, sitting and talking, because we only talk, right? The sitting and talking with, remember that she has a right to say no.
Amen.
Even if she said, yes, make we try it, and she says stop, she has a right to say no.
And even if she has said yes 3 million times before, she still has a right to say no even after.
Yes, and she's not teasing. She has her right. Okay, so those are the critical things I want to remember. The other thing that the minister spoke so eloquently about, I recognize from our whole conversations around the issues of abortion or termination of pregnancy, that the stridency is very high, the conversations, there's not much listening, persons are not listening, and we are informed from our religious perspective, and we don't necessarily want to hear about the context. What is the context that this woman is in, and why would she want not to take that, to carry that child to fruition? We need to just listen a little more, hear, and have an opportunity to have that conversation, and then for that person to make the decision. One last thing, call Yute Expression, get the information,
yes.
get the facts. Family planning, abstinence, consistent condom use, access for testing for HIV and for syphilis. Call us, we're there. We have the self-test kits that we perhaps can help you to just do on your own once you're over 16, So you can also get the self-test kits from us. So we're encouraging you, get the facts. Nothing travels faster than rumors and misinformation. So seek and ensure that you're getting the facts from the right source.
And it's your responsibility to absolutely do so. Mrs. Pious.
All right, so I really want us to look at how much do you value yourself. Are you a bag juice girl, or do you value millions of dollars? Because, and a boy too, because, look here now, we have a way of, we're too cheap here, man. We have to go back to where we value ourselves and think about how much you value. Yeah? Because I find that a lot of young people, in the height of the moment and the height of the tweet, them head gone out. And I also want to say, if there are any concerns around mental health, because that is another challenge, seek help. Nothing is wrong if you're hearing voices for you to go and look for help. If you're hearing voices, if you're not too sure what's going on, seek help. Yeah? The other concern I have is that we need to think about the youths that are not in the regular system. Yeah? Because, oh yes, youth in school and whatever, but some youths are not attached at all. And we need to think about how do we program them, how do we support them, and we also need to look about community culture and targeted intervention. That's my piece.
All right, thanks. You say you ask yourself if you're a bag juice girl or a bag juice boy, know your value. Oje.
All right, thank you. Before I get into my recommendation, I just want to underscore briefly something that was said earlier. And this is a reminder to everyone here that in order for sexual intercourse to be consensual and legal, consent needs to be continuous. So even though you're in the act, if someone says no, that is where you stop. I just want to make that clear. It's not just about consent before, consent during also needs to be taken into consideration.
Absolutely.
And my recommendation, I'm big on youth participation. And I believe that with issues surrounding youth, our voices need to actually be heard in a way that is substantial. And my recommendation to possibly the ministry or other entities is that going forward, if you're having discussions like this or interventions like this, the formation of some council consisting of young people to act in an advisory capacity can go a very long way, because we need to be able to be a part of these conversations. Not just looking from the outside and reaching out to somebody saying, hey, I think we should do this, but being a part in that, being a part of that body of people that are making decisions. So it's very important that we involve young people.
I appreciate that. Thank you so very much, Ms. Hamilton.
Thank you. I always say, try to look at the end of the story before you start writing it. Before you begin to write that script, think of the end. In other words, most of us know the consequences of most of the actions we're thinking about, but we usually, if me did know. Now, if you take the time to stop and, you think about what it is that you want to do, think about what will happen if I do X and what will happen if I do Y before you act. that will make a very, very huge difference. And let's say by chance you acted, but you didn't make what you thought was the best decision. The most important thing for you to do is to review and to think about what lessons can I take from my experience that I can apply going forward, and also learn from the experiences of others. And also check who you choose to surround yourself with. Do these people mean me well? The direction we tend to go in, is it mostly positive? Is it mostly negative? And most of all, remember that there is at least one person in your world that you can find to have that conversation with. It may be a parent, it may be another relative, it could be a friend, it could be someone at school, whether from teaching staff, admin staff, wherever. Just remember that you are not an island.
That's right.
Somebody was born before you. And it does not necessarily have to be somebody who is older than you too. It can be a peer. But just remember this: if you don't remember anything from today, stop and think before you act. Very important.
Thank you so very much. Ladies and gentlemen, students, thank you so very much for being here. I think my final recommendation would just be this to the legislators. We will always have different beliefs and different values, but certainly, hopefully, we can be inclusive and empathetic and mindful when we speak about other persons, and other persons are at the forefront. Let it be about them and not necessarily our own biases, please. For the students, for the youngsters here, your life is your priority. Believe it or not, at some point in time, it's going to be your responsibility. So just like when you're doing your SBAs and your projects and your homeworks and you have to go and research and find the source and find the information, it's the very same thing that you need to be doing when it comes to your own sexual reproductive health. And to the persons, the ones who are part of the programs, the entities, the agencies, the persons who are supposed to be there as support systems for the youngsters, we pray that you will continue to be professional, that you will also be mindful and thoughtful and empathetic and non-judgmental when these students come to you for the help that they absolutely need. Just like all of us, put your own problems to the side, your own belief systems to the side, and deal with the matter at hand. Thank you so very much to the National Family Planning Board. Thank you, Dr. Byfield, Minister. Thank you, Cuthbert-Flynn. Thank you for being here. Mrs. Pious, Oje Shackelford, I will never forget that very rich name. And Ms. Hamilton, thank you for representing your entities. And certainly, I hope you will stay around just to assist the students if they have any questions afterwards. Again, I am Dr. Terry Carol-Reid. It was a pleasure serving you in the capacity of moderator. Can't wait to hear more about Yute Expression. Congratulations.
Thank you.